presented by Professor Adeyinka Akande, who is a professor of chemical pathology at the University of Ilorin, North Central Nigeria. Is going to system which was the number of drugs that have very narrow therapeutic windows increasing by the day. And of course, drugs that have maximum tolerated dose are there. The anti-cytotoxic agents that are used for managing, and immunosuppressants that are used for managing patients that have had renal transplant, kidney transplant, and then liver transplant. So, Professor Akande, you have the floor. Participants, please, I want to crave your indulgence to stand by and listen to this loaded presentation by a very senior colleague. Thank you. Prof, you have the floor.
Well, thank you very much, Mr. Moderator. I hope the participants will had a very good time. I will be talking about the therapeutic aspect of drug now, and not the abuse type. So my own emphasis will be on what you need to achieve a therapeutic response and to avoid what we call a toxic outcome of a drug that is therapeutic in nature. So I want to shift here by going to therapeutic now rather than the abuse. And that is why I'm taking this topic. That's my name. I work at the University. I'm a chemical pathologist there. So by way of introduction, therapeutic drug monitoring is a major and it's been on since decades. The important thing is the concept that it applies clinical pharmacokinetics of the drug, which in a very simple word is the mathematical relationship between the drug and the biological fluid vis-a-vis the safe and efficient dosing regimen. So here we are concerned about what is safe, then we are concerned about efficient dose of that drug. And this concept is based on the assumption that there's a relationship between the dose of the drug in the plasma, and this concentration is related to therapeutic effect of the drug. And this will in turn determine the significant dose regimen of that particular drug. Since our focus here is about safety and efficiency of the administered drug. So it's simply defined as a timely and reliable determination of drug concentrations in biological fluid to promote effective drug therapy and prevent toxicity. So the objective is just straightforward. These two objectives: promote effective drug therapy and prevent toxicity. The other objective is that with this concept, it is possible to individualize dose within a known therapeutic window for a particular patient. Because what we currently practice is that this idea of giving predetermined dose of drugs to people, okay? But it might not necessarily work in all people. Some people is overdosing, some people is underdosing. So with this program, you'll be able to individualize dosing of drugs to people. However, it has to do with pharmacokinetics, pharmacodynamics, and pharmaceutics of the drug. And clinically, this is affected by certain terms, or certain terms must be recognized and understood when you're talking about drug monitoring program. And I want to particularly take note of the E item on this slide, which is the range of drug doses which can treat disease effectively without having toxic effect, which is called the therapeutic window. And I think the aim of every treatment should be aiming at this therapeutic window, where you have doses of drugs that are given to patients, and what you expect is that the dose should treat the disease rather than the dose having toxic effect on the patient. Now let's look at factors that can affect the plasma drug level concentration. And one of the first thing is drug disposition. Disposition has to do with the way the drug is absorbed, the distribution of the drug after absorption, the metabolism of the drug, the hepatic clearance, and biotransformation of the drug. Other factors will include drug-to-drug interaction, protein binding, and affinity of the drug to the receptors for which there's going to be a pharmacological action, and very, very importantly, what we call patient factors, which will include the age of the patient, the height and the weight of the patient, because sometimes you need to know what the surface area of the patient is, particularly in pediatric patient. The gender, very, very important. And the organ function of the hepatic and the renal organs, because these are the site of elimination and excretion. And sometimes specific drugs at designated interval and concentration that will give you an optimized therapy. So when you measure the specific drugs at designated intervals, you are virtually going to use the pharmacokinetic principle of that drug in the interpretation of the drug concentration in the plasma of that patient or the blood of that patient in terms of relevant clinical parameters, which we are going to discuss further. So what are the indications for this? I want to say that I think the most singular important indication for therapeutic drug monitoring is drugs with narrow therapeutic window. Just define what a therapeutic window means. And that is to say that you have drugs that the dosage you need to treat the disease and the dosage that will cause the toxicity as an unwanted effect from that disease, from that drug, is very, very narrow. So in this case, this is a very, very good program for you to avoid that. The other one is to monitor compliance problem in order to determine whether you are having over-treatment or under-treatment. It is very, very possible that you have cases of under-treatment and over-treatment medications or some drugs where the manifestation of the toxicity and the disease states are very similar. So when you are crossing the red line, the clinical symptoms you will see are similar to what the disease presentations or clinical examinations will look like. So for this kind of drug, and it is very, very important to note that a lot of broad spectrum drugs, but what many people don't know is, okay, so this is something that must be put in mind. And that's why the justification. So, like Daniel has said in his presentation, that are more accurate, specific, and sensitive now. And this has been limitation in the past, but for now, since we can do accurate measurement, is a justification for it. And I must say too that there are developments of so many pharmacokinetic database now to analyze and predict what a dose regimen designed for a particular patient should look like. This is what the application is. And the important thing here is the TDM tend to give you a strong correlation between the serum drug concentration and observed pharmacological effect. So because of this, the serum drug concentration and observed pharmacological effect, you want to apply a TDM. What's a pharmacological effect? A pharmacological effect is just effect that you see which can be therapeutic or toxic. So it has been established that there's a strong correlation with the serum blood concentration. The clinical use will include chronic abuse, to detect chronic abuse or recognition of chronic abuse, recognition of non-compliance, and particularly to address what we call therapeutic drug regimen adjustment. Sometimes you are treating a patient on a particular dose, you're not finding any result. Before you can go on to increase the dose or even decrease the dose, in some cases, if you have an untold effect, you must be scientifically supported by the therapeutic management program results. Dose-related toxicity is also a clinical use. And sometimes, like we have said in drug disposition, the metabolism, the elimination of the drug, which determines the drug concentration, sometimes differ from individual to individual. I'm very sure of an example of we know they are the slow acetylators, things that vary from individual patient to another. So these are the types. We have two types basically. And this one is based on clinical endpoints. And the clinical endpoint is what has been established by population-based studies between the pharmacokinetic and the pharmacodynamic of a particular drug. That's why when you want to start a patient on a particular dose, what we're saying is you have to determine what a start dose is for that patient. You don't, for example, just start and say so and so milligrams start based on an empirical determination. Each patient must have a way that you establish a start dose for them. And this one is a patient who is already on your medication, and you're just measuring to determine what the pharmacokinetics or the pharmacodynamics is all about. So let me go and use a few minutes to address the main topic. How do you set up this program? And I must say that the first thing you need to do is that you will require a multidisciplinary team. A TDM program is not done by only the chemical pathologists. It is done by a team. So you must constitute a team. And I've listed what members of the team should look like, but it's not limited to what is on the slide. But my important message here is that there must be excellent collaboration and cooperation, as well as effective communication between the members of the team, so that you can ensure best practices in the achievement of your objective. So the first thing you want to do is you have to set up a team in your hospital to do this program. Now you now have to meet with your team and develop many protocols. And these protocols, when you put them together in a book, it now becomes the TDM policy for that hospital. And I think this is where I want to employ my colleagues to start to work. I know it's not easy to write protocols, but you have protocols that are already written, and you're allowed to domesticate protocols. So all you need to do is you can domesticate protocols from programs that have been running in other hospitals. But your protocols must include the following. The first thing you want to write on your protocol is you want to determine the decision for request or the need to request for a TDM service. And the question you want to ask yourself is there any toxicity? How do we identify toxicity? What is lack of response to a therapeutic drug that is given? What is compliance? What is non-compliance? And how you define the chronic administration need of a particular drug. You know, some drugs are used chronically. Antihypertensives, for example, some are used, cardiac care drugs are used for a very long time. So the chronic administration need has to be defined in the protocol. And this will lead you to the choice of drug for the TDM in a particular profile of medication that you are concerned with. That will lead you to how to select the methods for assay of the drug, which Daniel spoke so well about in his presentation. Your protocol must include patient demographics, particularly information on the age, gender, and address of the patient. You must include the treatment the patient is receiving. We talked about drug-to-drug interaction, and the comorbid state of the patient is very, very necessary as a protocol in patient demographics. You want to know what other investigations this patient has been placed on or is going to be placed on. This is to enhance your service. So for every drug you are monitoring, there are other related laboratory services or tests that must be carried out to support your therapeutic drug program. This is very, very important. The sample required and its specification. And I think Nana's even talked particularly the type of the sample that you require, and the guidelines should be available for ideal sample schedule for each individual drug to be monitored. Just like Daniel said, some drugs are better assayed in the whole blood or the plasma or the urine, and the collection protocol for that sample. Don't forget that conditions could affect the stability of the drug in the sample, and these conditions must be considered. So when you are collecting, you must write good protocols for that particular drug of interest, making sure that all the factors that can affect the drug stability is taken care of. You must include sample containers because you're going to transport the blood sample from the point of in your container. You must state the storage specifications for that particular drug that you're writing in your protocol. And you must state the time of sampling because timing affects sampling in every drug. Just like we just said now, the formulation of the drug could affect the concentration, the metabolism could affect it. So the timing for each drug sample that you want to collect, you must know. And you must be able to relate even the date of the sample collection to the last dose of the drug that you are interested in. You must include in the protocol you are developing a section on quality control activities. What must you do in your internal quality control activities? And you must include things like what are the rejection criteria for a sample for that particular drug of interest? How do you do sample management? How do you log in the sample when you get to the laboratory and use of controls? Of utmost importance in any TDM is external quality control programs. So you must put into your protocol, what are your plans for external quality control program? And of course, you must acquire database software now, which will help you to calculate or to interpret the results of your measurements of the drug of interest. So you must have protocol on what drug formulation as it relates to the frequency and the dose, the plasma concentration, the time of the dose, and the time of the sampling. So there's databases now that have already incorporated all this, and all you need to do is just fill the age of the patient, and it's like a calculator, and you get the correct result. For every drug of interest, you must write protocol on the assay technique or assay methodology. And just like Daniel did emphasize, I tried to talk about some of the assay methodology and the advantages and disadvantages. So you must put this into consideration when you are writing the interest of drug. Another thing that must feature very well in the use to assess the physiology or efficacy of the drug. And this will include things like blood pressure apparatus, thermometers, and respiratory rate apparatus. And you are particularly interested in protocols in terms of the standardization and the way the measurements are carried out using these instruments. I'm sure very well if you tell 3 people to take the blood pressure of the same person, you might not really get the same reading. So you must state in your protocol, how do I take my blood pressure? Am I using the Korakov SAN 5 or 4, and so on and so forth? So your protocol must state this clearly. Or now you're going to use that instrument for your measurement. There must be a protocol on how do you determine the plasma profile of drug in every patient, depending on the drug that you are interested in. You must write something about how do you administer the predetermined dose of the drug, how do you collect the sample, and how do you evaluate the clinical response to that drug. These are things that must be well spelled out in your protocol in order for the program to be successful. In the protocol, it is also very, very important to have the drug profile, just like Daniel was trying to say. So the drugs has been grouped into profile based on the clinical use of the drugs. And the emphasis here is that the analytical method in one group is often applicable to other drugs in that same group. Can use the same method for many drugs in that profile. Therapeutic drug profile, the cardioactive drug profiles. These are all drugs that are clinically used for therapeutic issues, but they have very narrow therapeutic window. So for you to put patients on this drug, you must have a TDM activity. Not that you give, you come the next day, you look for clinical signs, and you reduce the dose or you increase the dose. I think that's what is commonly practiced in many centers now. And that's why I'm an advocate of this kind of a program in our centers. So these are, again, classes of the drugs that are used for various clinical treatments. For the antipsychotic drug, you have lithium. So for example, if you are writing a protocol on TDM for lithium, you know that you cannot collect the sample in a lithium heparin bottle because you're already having lithium. So this is the kind of thing you have to write a protocol. If it's for lithium that you want to monitor, then you have to write a protocol on the sample container so that everybody knows what to do. Your protocol must also include related drug laboratory tests. Like we mentioned, the liver and the kidney are both sites of excretion and elimination of drugs. And these two organs, the functionality of the two organs determine the blood concentration. And the blood concentration of the drug will eventually determine the clinical pharmacological effect of the drug. So this, for every drug you are monitoring, you really want to know what accessory tests, laboratory tests to be carried out. Lipid profile, for example, because when you talk about drug disposition, you know, drugs have to cross many biological profiles, particularly when you talk about absorption. So crossing these biological profiles you might want to do this lipid profile because membranes are lipid in nature, and it is very, very good that you want to do the profile. So these are a few take-home messages that the TDM program is mainly for promotion of drug efficacy and prevention of toxicity. And this we have to bear in mind when we are using therapeutic drugs. We don't want to cause more problems for the patient. We are more interested in having a very good therapeutic window. Doses given to the patient that can help the patient to cure the disease and not to cause them toxicity. And I must say again that the TDM program is only specific for drugs with narrow therapeutic range. So TDM program is not for every drug. It is for drugs with narrow therapeutic range or therapeutic window. Sample collection protocol is the fundamental part of a proper program, and you cannot overemphasize these samples. I think Daniel also talked about it. The timing is very, very important in TDM program, and you must get your timing right when you are writing your protocol. At what time do you administer the drug? At what time do you take the sample? At what time do you repeat taking the sample if the need be? These are all very important, and like I said earlier on, related to pharmacokinetics and dynamics of the drug. The method of assay cannot be overemphasized because you need very accurate, precise, as well as specific and sensitive assay method in order for you to get the true concentration of the drug in the plasma. I thank you very much. These are the few references for further reading, and I hope it will be helpful. And I want to say that if I've not said it simply enough, it probably means that I don't even understand it enough. So thank you for listening, and over to the chairman. Thank you.